Hello, I'm Mandy Russell, and I'm in Dr. Krista Schumacher's General Epidemiology Course, MPH 5323 at Oklahoma State University. This week we are learning about cohort and case control studies. The first one I'm going to review is my cohort study. The title of that study was Adolescent Electronic Cigarette Use and Tobacco Smoking in the Millennium Cohort Study. So the purpose of the study was to analyze the determinants and associations of adolescents at different ages who use and do not use e-cigarettes and combustible tobacco, and compare it with later use at age 17 or non-use of smoking tobacco. The study design was intergenerational, as it followed the same group from infancy through age 17. It was a prospective study, as it looked forward to predict cigarette smoking at age 17 based on usage at ages 11 and 14 through odds ratios. How can findings be applied to public health practice? So we can use this information with prevention efforts aimed at youth who currently vape or use e-cigarettes and try to prevent them from continuing vaping or smoking cigarettes. If we can help those that are using vaping to quit, we can prevent them from being future smokers and prevent diseases linked to smoking like cancers, hypertension, and type 2 diabetes. So this was a prospective cohort study that looked at infant and childhood risk factors like sociodemographic features of the child's family, as well as if the child was exposed to secondhand smoke by the mother, either during pregnancy or in the home after the child was born. Data was collected from parents when the youth were ages 3, 5, 7, and 11, and when the child turned 11, they also began being interviewed for data collection. Youth were interviewed at the ages of 11, 14, and 17 about cigarette smoking, at ages 14 and 17 about e-cigarette or vaping usage, recency, and frequency. So the results, and this is a quote, the odds of ever smoking by age 17 were more than 5 times higher among youth who had used e-cigarettes by age 14 compared to teens who had not. Staff et al. 2021 on page 47. The odds ratio was 5.31 with a 95% confidence interval equal to 3.27 to 8.62. The next quote, the odds of transitioning from never a smoker at 14 to a frequent tobacco user at 17 were more than 3 times higher among youth who had used e-cigarettes by age 14. Staff et al. 2021, page 487. The odds ratio for this was 3.59 with a 95% confidence interval equal to 2.04 to 6.22. Now on to my case control study, which was the association between occupational history of exposure to tobacco dust and risk of carcinoma cervix, a case control study. So the purpose of that study was to see the association, if there was an association between those who were exposed to tobacco dust in work settings with the development of cervical cancer. It was a case control study. Those findings can be applied to public health practice in several different ways. First being, we could apply it to public health practice by seeing that those who have occupational exposure to tobacco dust without using preventative measures are associated with the risk of developing cervical cancer. Number 2, ensuring occupational safety measures are in place to reduce the risk of cancer for those who work in environments where they're exposed to tobacco dust. The overall working conditions in India are poor and need policies in place for safe work environments. Another way we can use it in public health practice is to educate Indian women on the importance of periodic screenings for female cancers, as they were very reluctant to undergo any kind of cervical cancer screenings voluntarily. So this case control study used data from a government and a private care hospital in Bangalore, India, for a 2-year study period from 2011 to 2012. It's already known that smoking and chewing tobacco are risk factors for cervical cancers, as well as secondhand, or what they can call passive smoking. This study examined if the inhalation of unburnt tobacco dust was also a risk factor for cervical cancer, since India's crude incidence rate for cervical cancer in women is 20.2 per 100,000 women, which is much higher than the crude rate for women worldwide, which is 15.1 per 100,000. There are millions of Indian women who work in the beedi manufacturing sector, which involves the rolling, roasting, fumigating, and packing of tobacco flakes. In the United States, we would say that would be where they manufacture cigarettes. So exposure rate to tobacco dust following beedi rolling was 63 among cases and 38 among controls. The p-value of 0.0005, or the odds ratio of 1.893, with 95% confidence interval, 1.207 to 2.971. Joseph et al., 2016, page 45. So the results were being exposed to a tobacco dust during the manufacture of beedi for 3 more hours a day, and more than 20 years in their lifetime was significantly associated with developing cervical cancer. And all that information is from Joseph et al., 2016.